One of the conditions that we treat very often, but is a fairly rare condition, is something called complex regional pain syndrome. This is a syndrome where your nerves and pain pathways have gone out of control. It's very common in extremity injuries, let's say an ankle or a hand, but usually happens after multiple traumas. So I see this in patients that have broken their ankle, had a surgery, needed a revision surgery, broken it again, and by the time they've had 4 or 5 surgeries, what starts to happen is after the healing is complete, the ankle starts to swell when it shouldn't. It starts to turn blue or turns red. It gets very hot, it gets very cold, and the sensation is more of a burning and a hypersensitivity. They can't take sheets landing on it. They have to sleep with their foot outside of the bed. And so people ask me, what's going on here? So what's happening is that you're getting sensitization of your central nervous system each time you have this injury and surgery. And the pain pathway gets sensitized over and over and over again to where it starts to fire when it shouldn't. The other thing that happens is there's a separate nervous system called the sympathetic nervous system, and it travels along your nerves and it innervates the blood vessels, the sweat glands, and some muscles in your hair follicles that's responsible for dilating the blood vessels and contracting them. Unfortunately with CRPS, for some reason, the regular nerve pain fiber starts to talk with the sympathetic nervous system. So now when your body wants to dilate the foot, you have extreme pain. When you have extreme pain, the foot turns cold or it turns red hot, and now you get this constant feedback loop where they're talking to each other, and it basically turns it on all the time. So this is a condition where early aggressive intervention is really important. It's important to get some what's called sympathetic blocks performed. It's important to be aggressive about physical therapy and ramp up on a subset of medications that's really good for nerve pain. But think about this condition like a forest fire. If you look there and you see some smoldering in the dry brush, you want to jump on that thing, you want to beat it, you want to hit it with water, you want to do anything you can to knock it out. This is the same thing with CRPS. You don't want to dance around with it. You don't want to, start at a small dose and see what happens. It's a full court press of peripheral blocks, medications, physical therapy, and you got to be aggressive with it. So if you have an extremity injury and your limb is hot, cold, hypersensitized, nobody seems to know what's going on, you might be developing CRPS or complex regional pain syndrome. It's important to get in with an interventional pain specialist to get a treatment algorithm going. But if you think this is happening to you, please take action and see somebody soon, because the earlier you get on it, the better your chances of a long-term outcome. Thank you.